I'm Annalie Delaney, student number T00792249. So this is assignment number 5, the sense organs. So I have the list here. I just printed it off of the assignment directly. So starting off with the ear, we have the pinna, and then the external auditory canal. There's the vertical and the horizontal aspect. The tympanic membrane, you can see it there, and the cochlea, the auditory ossicles. So those are those three structures there. There's the malleus, the incus, and the stapes, and those are the semicircular canals. The vestibulocochlear nerve would extend off of the cochlea, and then the eustachian tube is that right there. An oral hematoma is whenever the pinna fills with blood or fluid, usually caused by an underlying condition like an ear infection or an irritant in the ear that's causing the animal to shake the head, which leads to a broken blood vessel. And then the area where in between the cartilage and the skin will fill with blood. So there's two treatment options. You can either drain it and suture it so that it doesn't separate again, or you can leave it as is and it will reabsorb, but it can leave the ear kind of deformed. So moving on to the eye, I'm just using my textbook again. So starting off, we have the cornea and the pupil, the iris, the lens, the ciliary body, and the suspensory ligament found on the top and bottom. And then you have the lens. I guess I already said that. The choroid, so that's that structure that goes around. And then the retina is kind of on the inside of that. The optic nerve is that nerve there. And then the optic disc is that area there. The sclera is the white of the eye. Kind of goes all the way around. And the tapetum would be found at the back of the eye. That's that reflective surface found in a lot of animals whenever you shine a light in their eye in the dark. And then we have the vitreous humor is in there. That's gel-like consistency, and the aqueous humor is in there, which is more of a fluidy, liquidy, watery consistency. And then you have the conjunctiva. So there's the palpebral conjunctiva, which is the eyelids, and then the bulbar conjunctiva, which is the eyeball itself. That's that lining of it. Then we have the medial and lateral canthus, so that would be the medial canthus and the lateral canthus. And then the nictitating membrane, or the third eyelid, is kind of tucked in there. And then the location of the nasolacrimal duct is from there down into the nasal cavity. And then moving on to the eye muscles, so I'm going to use this one. So that would be the dorsal rectus, the ventral rectus, the medial rectus, and the lateral rectus. And then the ventral oblique and the dorsal oblique. And then I'm going to go back to this diagram. So the muscles that control the lens would be the muscles of the ciliary body, or the ciliary muscles. So whenever they relax, that allows that lens to flatten. That's when we would be looking at farther away things. And whenever they contract, that makes that lens rounder whenever we're looking at things closer up to focus on. And then the pupil, so that's the opening in the iris, that will allow light or not allow light to come in. So whenever it allows more light, that's when we're in dim lit areas, and whenever it allows less light, that's whenever we were in bright areas. And that opening is controlled by the muscles of the iris. And then we have, so nociception is the process of experiencing pain. So there's 4 stages or parts to nociception. So there's transduction, transmission, modulation, and perception. So transduction is whenever your body recognizes there's pain and that changes it into a nerve impulse. And then the transmission is that nerve impulse getting sent up the spinal cord. Modulation is changing of that, so either making it worse, making it less, and it can be changed. It can be made worse than it actually is or made less than it actually is. It doesn't always line up with what the pain actually is. And then the perception is what the brain finally receives that nerve impulse as, whether it's worse or better, or less. But yeah. And why it's important for us to be able to identify pain symptoms in animals. They're not very good at telling us. Obviously, they can't speak. So us to be able to recognize those signs of pain is super important to be able to treat them and recognize what's going on, whereas they can't tell us what's going on exactly. But yeah.